Welcome to the Whole Health Podcast,
where a functional nutritionist and a biological dentist investigate the interconnectedness of your health.
Let's get started. Welcome back to the Whole Health Podcast. And today I am thrilled to welcome Adriana McCulloch to our show. Adriana is a lot of things in my life, but she is first and foremost for this podcast, the owner of Choice Coaching. She is a mother, a certified life coach, a breast cancer survivor, creator, and mentor, and she has dedicated her life to helping people navigate life during and after cancer with strength, clarity, and a renewed sense of purpose. Her mission is to transform the way people experience cancer, not just as something to survive, but as a catalyst for powerful and lasting change. And she holds a bachelor's in psychology, coaching certification, and has completed numerous master classes in marriage and family therapy, and has 2 decades of experience successfully coaching and mentoring individuals. In 2020, Adriana was diagnosed with breast cancer, which shifted her focus in her career. What was once a career built on professional experience became a career blending professional and personal experiences. So thank you for being here. I'm really excited to talk to you today.
Me too. Thanks for having me.
All right. So that was a little bit of your background. You were already in coaching.
Yes.
What drew you into that career?
Oh, geez. I've always wanted to help people. I've always kind of been perpetually the bleeding heart. I've always, honestly, as long as I can remember, I had this like, I need to save the world vibe, which is great, but also it's a lot to carry. And so it wasn't until my teen years when I had just a big like upheaval in my personal life. My parents got divorced very, very kind of out of the blue suddenly. It felt like for us, I should say, not my parents, I'm sure. So I started digging into a lot of therapy. I started going to a lot of therapy, and that is really when it changed my perspective on how much control I had over my own mental health and how I view the world and how I see things. And, that really helped me kind of get an idea of, wow, this is something I want to do. I'm going to help others as much as I can because it's helped me so much. And also was so empowering, it was very hard. It's a very difficult time. And so I started honestly mentoring people in high school. My high school counselor started asking me to mentor I was a sexual abuse survivor, and just asked me if I would just like talk to other girls in high school because I had done so much work and so much processing of that trauma. And that was kind of it. So from then on, I knew I wanted to help in some way, shape, or form.
Wow.
Yeah.
Okay. So what type of coaching were you doing prior to shifting your focus?
So initially I kind of did anything, right? You're like fresh out of the gates and you just want clients. You want to help everyone. You want to do everything. And then over time, it kind of narrowed down to transitions was a big one for me. And ironically, something that I kind of really did well in, kind of excelled in, is helping people get positive results from transitions that they did not choose. So whether it was, getting laid off or a divorce that they didn't see coming or, anything like that. So ironically, when I switched to working with people who experience cancer, like that's, like I didn't choose that, and of course nobody chooses that. So ironically, those years of kind of focusing on that and doing very well kind of prepped me for the transition that of course I didn't know I was going to do. I didn't know I was going to go to cancer coaching.
Right.
It was not in the plan.
That was not in the plan.
No, it wasn't a 5-year plan. No.
Okay.
So did you, did you intentionally choose the pursuit of like a psych degree, for instance, because of this desire to, well, as you said, like help people?
Yeah.
And did you already know that coaching was like a field you wanted to pursue?
No. That's a great question. No, I did not at all. So I was like, I want to be a therapist. That was like no questions asked. That's why I went to University of Oregon. They had a great psychology program, and it was rainy and woody, and I was like, cool, let's go. I'm that Oregonian at this point. And then I started my master's at Lewis and Clark, which is a phenomenal program, very hard to get into. It was great about almost halfway through, to be honest. Like it was not the right fit for me, and it took me a while to understand why. And I didn't know what I was going to do. It was kind of a crisis, an identity crisis, And it's not that I didn't want to help people. It was just I kept kind of feeling like it wasn't right. It wasn't aligned. And I was like, well, I'm gonna take another class and I'll go into next semester and see how it goes. And I was doing fine. I was doing well. I was B's and A's, but it just wasn't hitting. And then I had a professor, because that was in, 2002, 2003 maybe. And he was like, listen, I've seen you, I understand what's going on. Have you heard of life coaching? I was like, no. So he had just gone to some kind of a mental health fair or a psychology fair or something. I honestly don't remember. And he had just learned about it. So at that point, there were very, very few certification programs available. And I feel like a lot of them online were kind of scams. It's very different now. You can get way, way more information, and you have access to a lot more of legit certifications. And there was a school in Portland, and I looked into it, and I dropped out of my Lewis and Clark master's program. Wow. I know, it saved me a lot of money, but and that's what I started doing, and it was great. And it was a condensed program. I was in there for, I think, 18 months. And I will say, though, I think if I didn't have my psychology background, I don't know if I would have gotten out of it as much as I had, because it was still kind of new. So it's a lot easier now, because when I first started coaching, nobody knew what it was. Mm-hmm. And I guess it's pluses and minuses, right? Because a lot of people call themselves coaches and don't have extensive training. So there's that taboo I bring with me now when I tell people that I'm a coach. But at least people have an idea of what it is. Whereas before it was like, so you're a therapist. I was like, no, I'm not a therapist, But so you don't know how to help people. I'm like, no, I can help people. I can. So it's interesting. I kind of have like a smooshed combination of the two, where I definitely life coach. That's definitely what I do, but I do it kind of psychology based. Like a lot of life coaches don't touch emotions. They don't touch the past. And I don't necessarily stay focused on the past when I work with people, but if I see a pattern, we're gonna uncover that pattern just to get to the root of the challenge, or the difficulty that's creating the challenge, I should say.
Okay, so then 2020.
Yes. Fun year.
Rough year for you.
Rough year for everyone.
Obviously, it exposed you to something that shifted your career. You want to talk us through that experience?
Yeah. So I was 41 when I got diagnosed, and I always hesitate to say this statement because I can't speak for everyone, but for such a vast majority of young to midlife adults who are diagnosed with cancer, it feels kind of out of nowhere. It feels out of the blue. I believe it's like less than 9% of breast cancer patients have the gene, the genetic marker, at least ones they've found so far. So for a lot of us, it feels out of the blue. So it did. It was already a hard year with COVID. And, the rug is just, to say it's ripped out from underneath you is an understatement. I had young kids. I had an 8 and a 10-year-old. You have all these life plans. I was a very healthy person. As Megan knows, I did all the things. I did all the things I was supposed to do. I ate plant-based diet. I exercised since I was 17, 5 days a week. I had lower stress levels. I nursed for 3 years straight. I did all the things. And it was stage 2 too, which was it was my first mammogram. So that was shocking. And it was just like a routine mammogram to, let's just see, to get a baseline for you. I had just had an exam from a doctor, and they're like, we don't feel anything, but let's just get you recorded, So thankfully they did send me, and thankfully I was called back to go in because we wouldn't have known. Anyways, and, when something like that happens out of the blue, in my opinion, that severe, is an absolutely traumatic experience. And I think that term isn't used enough with cancer. I firmly believe when you get diagnosed with cancer, if you don't personally feel that it's at the level of a trauma, it's at minimum a traumatic experience. And there is, to answer your question, very long-winded, there is very little emotional support for cancer patients. And what I have found being 41 is that I'm lucky I had breast cancer because it is so common. There's so many of us. So there is built-in kind of community everywhere you go. Sadly, but also thankfully. But it is not geared towards a younger generation. It is geared towards a much older generation. And so what I found was not only was there a lack of emotional support But anytime I would put myself out there, which is very difficult to do when you're in that vulnerable of a situation, to put yourself out to find community and to actually do something about it. But that's how I'm wired. If I'm hurting, I will figure it out. I'll just keep trying things until I find a solution. You go to these places and you most often feel very ostracized because the women that you're around, the organizations that you're around, are talking about things like, oh yeah, well, I was lucky I was just retired and so we sold everything and now we're traveling. Or I don't want to pass, but I've had a great life and I have grandkids and blah, 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 blah. And I'm like, I haven't even hit perimenopause. Like, I'm supposed to be entering my sexual peak. Like I got plans. I got careers to worry about. I have all these other things to worry about, and your body image issues and your intimacy issues and how do you talk to your kids and all these challenges and obstacles that are so overwhelming. There's just not support for it. And again, I do, like I said, I will reach out and get the resources I need. So I talk to social workers, I talk to some therapists, and luckily I had a lot of tools, of course, from my trainings. So I did a lot of self-work. But those waves of kind of emotions that you are feeling like you're drowning in still came. And that's when I was like, wait a second, I can't be the only person feeling this. And then, mostly people online I've reached out to, and there are communities online of younger cancer patients. And yeah, that's a lot of what they were feeling too. So I was like, well, how can I not do that? How can I not start helping others? And at minimum, just to be like, hey, you're not alone. I mean, genuinely, like, I just want everyone to know that you are not alone. You don't have to carry that burden alone anymore,
So the medical experience is one part of cancer, and it's scary.
Yes.
And I imagine people benefit from support throughout that process of actually being in treatment, because there's a lot to navigate with your emotions and your psychological experience. Sure. One thing I've seen and I'm curious about is the experience after treatment, regardless of what the prognosis is or what you're told your prognosis is, or maybe you don't want to know because those are numbers that actually have nothing to do with you, right? And you're just moving on.
Yes.
But what is it like supporting people after treatment when they're living with the fear of reoccurrence?
Yeah. That's a really valid statement. I think when I do work with people that are actively in treatment. And I think that's great to do because you are preparing yourself. You're kind of doing the groundwork for the after post-treatment if we're, stages 1 through 3. But it is, I believe it's your nervous system, right? Your nervous system, when you're diagnosed, your nervous system is in fight or flight. You have incredible amounts of information being thrown at you. And the at least the institutionalized medical world, it's very like, you have to act now. You have to act now or you're going to die. I mean, they don't say that, but that's the energy behind it. They say that in so many words. So you're making these what feel like life and death decisions at a very rapid race under immense pressure, right? And it's hard to even think clearly. So your nervous system and your brain is really so focused on that when the emotions come up, even if they're there, how do I say it? You have a path, right? It's like, okay, first you're going to, like for me, I started chemo first. So it's like, okay, A, we're doing chemo. It should be this many weeks. B, we're going to do a mastectomy. It should take this long and you should, so you have these like little things to check off your list. After treatment, it's just quiet. It's like the doctors kind of disappear. A lot of the support disappears, and I'm not like we need to throw shade at like the people that supported me, but that's what happens is your hair starts to grow back and people are just gone. You're starting to be able to like exercise regularly again, possibly. And like it's like, oh great, you're okay now, and that's when this flood of emotions comes in. And that's when I feel like for 90% of people, or probably greater, honestly, at this point that I have spoken to, the time after active treatment is the hardest to deal with emotionally. That is, yes, it's the fear of recurrence, but it's also people don't even know who they are anymore half the time. It's this, I just want to go back. I just want to forget that this happened and I want to go back. Well, if anyone's experienced a traumatic anything, that's not how it works, unfortunately. So it's a lot it's a lot to dig through for most people, to be honest, post-active treatment. But like anything, there's a solution to everything. Everyone is different, so it's a lot of working with that individual person as they are as an individual, what works for them, what helps them the most, and, sifting through those fears, and half the time we have to kind of turn around and face them, which is not what people always like to do, but it makes them smaller when we can identify them and we actually like kind of look at them through a curious lens. Mm-hmm. I create a safe space to do that.
And you're also really, I know you personally, so I know that there's an element that I would imagine that makes you effective because you're fun.
Yeah.
You're like, yes, in fact, I am fun. Yes, I'm fun.
I'm not the typical life coach. So I always do consultations, right? I always do free consultations. And that is, yes, for people to see if they want to work with me. But a lot of it is for me to give them an opportunity to be like, hey, I'm not quiet. I'm not, I'm loud. I'm a lot. I'm not in a negative way.
You wear red lipstick.
I'm just very
Says it all.
expressive. Mm-hmm. I'm energetic. And yeah, every session we're giggling, laughing, but we're, clients are crying and it's okay, but I always say like healing can be fun too. It's not, so if you're not looking for that, you don't want to work with me. I also am like, I will push you when you need to be pushed, and I will do it when it's time, when it's appropriate, with the proper support. But I'm not just going to tell you, I'm not here to tell you you're doing a good job every single second of every single session, because my goal is to get you where you need to go, not to keep you where you're at,
It seems to me like you've kind of found this void in a healthcare experience, to your point, that is so common.
Yeah.
I mean, sadly, the number of people I've met in my own clinic who are, breast cancer survivors, it's just unbelievable. And I was thinking about how in any branch of healthcare, through my lens, world of biological dentistry, it's so common that the focus is on, we see this issue, we suggest these treatment paths, and we don't consider what does this feel like to, for instance, have a mastectomy, have half of your teeth removed, lose your smile.
Right.
And the emotional component to that is massive.
Sure.
That's at least been my experience. What have you found kind of coming through your own health experience, but then parlaying your coaching skills? What are some of the things you've experienced or learned that you didn't expect?
Oh, interesting. A lot, probably, like a lot more than I could think of off the top of my head. This is like the 3 a.m. question that I'll have. I'll wake up at 3 and be like, oh, I know another thing that I but so I will text you. And you can talk about it.
He'll be awake already.
Perfect.
Yeah. I'm totally that person that I process quick, but I also process long. I think I've always known that your mental health is just as important as your physical health, but there's nothing like cancer to teach you that. I've always known that I can't control everything, but I think I thought I could. I thought I had way more control over my physical health than I did at the time. Now, thanks to you and your amazing team at BioLounge, I've learned so much more about my individual body. And again, I was very healthy, and I was very much about the education around health, not the old school food pyramid, not the, really nutrition dense food. It is kind of how I was raised too. So I thought I had a lot more control over it. And then there's the little things, right? Not that everything is little or big, I guess, in some way, shape, or form. But for me, the first thing I did when I knew I was going to chemo, and I just digested that as much as I could, I went and got a new journal, and I have a ridiculous amount of empty journals in my basement. It's not cute.
Me too.
It's ridiculous. Well, when I see them, I'm like, oh, I'll buy that, and I will use it. And I bought a new one. because I didn't need to at all. And like new pens didn't need to at all. But it was during COVID. So I was alone for all my appointments. Like my husband had to drop me off outside of the hospital for all of my appointments. Luckily, I'm social and I will tell people exactly how I'm feeling. So the nurses like saved my life. They were like, because it's very, very scary. But I that's what I did is I brought a new journal and I wrote down, and I do this often with journaling. Like I will write like cue questions. I always call it like self-coaching, like at the top of a page, and then give myself a couple of blank pages. And one of them was like, what do I want to learn from my cancer diagnosis? And I think it was because it was COVID. I mean, I would be there for 8 hours on average. I think it's much quicker if every all the staff members are there and all the, because the infusions themselves were maybe 2 hours put together. So the first couple of times that I went, I was like, I don't know, like, because I work on myself a lot. I'm not saying I'm not perfect, but I was like, I don't know what this is showing to me. Well, over time, you sit there enough for 8 hours at a time alone, you'll come up with some good answers, and a lot of it was things that I have total control over, like self-induced pressure. That's a big one for me, and I think a lot of that's just I'm really artsy and this and that, but I'm also very type A, so you learn a lot of things. So I think the bigger scheme, the grand scheme of things are less control, and then the smaller things are probably personal for everybody. But that was a big one for me.
So when you moved into this field, you shifted into life coaching for cancer in general. I'm curious about not just the lessons that happen after that with people as they're kind of processing through, but one of the things that you talk about that I think is not talked about is the intimacy aspect.
Yeah.
And it's coming up more for you. So I'm wondering if that's because you're seeing it more or if it's just like you're ready to talk about it. But the ability to be comfortable, not only in your like mind and heart, but how do you get back to being comfortable? I guess what I'm saying is let's talk about sex.
Yeah.
Okay.
Baby, let's talk
Yeah,
about you
let's
and
do
me.
it. Let's do it.
Let's talk about all the good things and the bad things.
Yeah.
I didn't sing that. I want everyone to just know that I actually said that. It's hard not to, though.
Talk to us a little bit about that, not your experience, but the overarching experience of being a female after treatment and where that lands. Where is that a sticking point for people and how are you supporting people there?
Yeah, it is not talked about, but I think sex isn't talked about, period. Right. Yeah. And we all know women's health is very much not talked about. So, for me specifically, breast cancer, right? Because I will work with people that have experienced other cancers. Breast cancer, there's just a lot of us. So as we know, or as, fact is that the most common cancer, breast cancer, is hormone positive. So we have our estrogen and our progesterone positive. So what they do with treatment, like you were kind of referring to, is like, we have this is how we treat it, blah, blah, blah. So one of the treatments is to basically rid your body of estrogen and as much as possible. So it's really not fun. It's hard. It's hard on so many levels. So I wasn't even in perimenopause because I did actually test my hormones before. I wasn't even in perio. I was 41 and I got put overnight into menopause. So that alone, regardless of all of the physical changes, is an insane amount to manage. Your sex drive it's just like the tap is turned off. And your body hurts like so many ways. But I think just as big of a challenge as menopause is the mental and emotional side of it. I mean, for a lot of people, it's traumatic to have their body touched because it reminds them of their cancer. So for a lot of women, they don't want any kind of intimacy. For a lot of women, they feel, because I often refer to my foobs, my fake boobs, I'm like a Franken boobies, because it's not. I know everyone knows this, but just PSA, it's not a boob job. I mean, they literally take out all your breast tissue. They took out all my pec tissue, and you just have these mounds of silicone, or if you're lucky, you can do a deep flap and you can take fat from other areas of your body. It's a major surgery, but side note. So I don't have nipples. I've got these crazy scars. The foobs do not look pretty without clothes. If I'm lucky that they look okay with clothes on, because not everyone's reconstruction is that great. So my roundabout point is we're very much in our heads, generally speaking, about what we look like in order to feel like we have a place to ask for sex, that we are sexy enough to engage in sex, you know? Oh, I'm too fat. Oh, I'm too this. Well, imagine what it's like looking at your body and being like, I look like a freak, you know? Because I kind of do. You know, so a lot of it is about learning how to love your body for what it is, and that you are worthy of sex and you do have enough value to be a sexual creature. So much of it really is mental. And I can't remember if I mentioned, but some women they feel like so embarrassed if their partner sees them naked. Like that's how deep the visual can run for a lot of women. So I really just help focus on learning to love your body again. You know, it's not, aside from sex, I remember looking at my body. I gained an incredible amount of weight during chemo, and I only knew the movies. Even though I've known people that went through chemo, I was like, I'm going to like be looking like a skinny, you know, super unhealthy. Oh no, I gained 30 pounds. That's a lot of weight for my frame, 30 pounds. I'm 5'9", so I shouldn't sound like I'm like 5'1". But still, it's a lot of weight. And I remember looking in the mirror and being like, oh my God, ew, I'm so this and that. And I was like, girl, what am I doing? My body is literally fighting for her life. Sorry, I do this. I talk about my body in third person. I don't even realize I do it. But like my body is fighting for its life. And I'm looking at it and getting critical and chastising myself for what I look like. So it's so ingrained for so many of us women. So even on just looking in the mirror by myself, you know, and imagine that translating to being intimate with a partner.
Right.
You know, so it's a lot of emotion. It's a lot more emotional work than I think because people are like, well, you can't help me because people have like vaginal atrophy. And they're like, you can help me with that. And I'm like, no, I can't. But there is a massive chunk that I can help you with that will help your intimacy life and just to love yourself again, regardless of a partner, you know?
Yeah. Yeah. And it is not talked about. There's, you know, I think we both work in the cancer and post-cancer realm, and there is, you know, and I know we talk about, you know, root causes of cancer. There's all these conversations, the root causes, the treatment while you're doing it. How do I keep my body healthy after? How do I heal? How do I recover? How do I prevent it from coming back? I eat the right stuff. I got to exercise. I got to sleep. But the nervous system at large is creating the chemicals in our body.
Yeah.
The nervous system is driving the ship. And so if we have this medical approach that just completely, just doesn't have resources, I guess,
Sure.
for that aspect of healing, recovery, and maintaining your health.
Yeah. Yeah. I always say, I just get frustrated with the absolute lack of I shouldn't say awareness, maybe like communicating that it's going to be so emotionally difficult from institutionalized centers, health centers, cancer centers. And this is coming from someone that like loves mental health. Like I love it. Like I genuinely I love it. Like it makes me, everyone's like, God, what you do must be so heavy. I'm like, oh, I kind of get like a buzz. Like I am like, I love it. Right. I do. And yes, it's hard but it's just, I love it. So even going into that, knowing that it would be difficult and doing the work and everything, there was no like, hey, just so you know, from your oncologist, from your radiologist, I don't care, any of them, just so you know, this is extremely difficult to bear emotionally. And there will be a time, and it might not happen immediately, but just so you know, and here are some resources. I just would have loved to, here are some resources. I know that that's not what they're trained for. I know that isn't, but again, I'm sure there are always exceptions to the rule, but it's the just ignoring that we are a whole person. Hi, sorry. You guys are like, and we're taking over.
Say.
No, I'm just like, man, this is our life.
Yeah.
You know,
Yeah.
Things are totally separate somehow.
Do you look back at your cancer diagnosis and think that it sounds like you had to do a deep dive on some things that you hadn't
Yes.
been familiar with in your own lived experience.
Yes.
But does it feel in some ways, I hate to say this, it's so cliche, but does it feel in some ways like it was the blessing for pointing you in the direction of being able to do this work with people where there's just such a void?
Yes. But that is how I know this is, again, cliche. I'm like, when I was 14, but it was a really, really hard time for me. And that was kind of my first like mental health awakening was when I was just a child. It made me grow up very quickly, those experiences that I experienced. But that was, I think, one of the most empowering things is I cannot control what has happened to me, but I can control what I do with it. And I can choose what I do with it, and that's something that I have taken forward into my own life as much as possible, right? At least in the end, because it doesn't always happen as quickly, or sometimes I don't realize that I need to be doing that. And then also into my clients, into my work for sure. And I always just think, this experience can either break me, it can harden me, which I almost feel like is worse sometimes. And we all know people, or we've experienced that, or I can grow from it in some way, shape, or form. And that sounds cliche. And it's not easy. But I don't want to be hardened. I don't want to be broken, and I'm the one that has the choice over that, not the cancer, right? That cancer doesn't have that control. I do. And that is the only thing that I can control. And that was, again, back to your question Kelly, is that, that was, I always knew that I can, mental health was the only thing I can really control. It's the only thing I have control over is my thoughts and my awareness. And even that I don't always, but at least try.
Yeah. And it seems, we talk about the coaching and supporting, and, it's one thing to give somebody a plan, and it's another thing to help advocate and support them through implementation of the plan, implementation. Yeah. I think what's interesting about what you do, there's a lot of things, but one of the things is no one gives a person a plan for post-cancer. It's not like, and here's your plan. This is what you're going to do every day. This is how you're going to get your mind straight. There's just, okay, call me if anything weird happens. Come back in for your check, right? Yeah. So people are out there with no plan and then no support.
Yeah.
When you think about your experience and then all the people that you've worked with, is there anything else that you look at and you say, the system's broken, this should be fixed, or this is also what is missing that would support people going through this type of care?
You mean from the doctors?
Not necessarily provided, but through the patient experience or the human experience of going through a diagnosis like that, and then treatment, and then survivorship.
Yeah. I think what is missing, and again, I understand why, and I understand that the medical system that we currently are living in is not set up for this, but I think the individual is what needs to be taken into account more than anything, and I feel that way medically, and that's why, coming to Bio Lounge, it was like, here is your body. Because before that, I got nothing but, well, you're 41, you had stage 2. Here's your, you had class 3, blah, blah, blah. Here are your percentages of recurrence. Here are your percentages of survival. And I'm like, cool. And I even asked them a question, if I do this and not that. And they're like, well, we don't have data for that. And I'm like, but with this and with that, well, we don't have data for that. I mean, they told me I had a 40% chance of recurrence. That's a huge number for someone that is doing all of the things. And that was, they do give you a plan, and it is eat plant-based and exercise. And I was like, I've been doing that, so the lack of individualized attention, and that is actually one of the reasons that, and also like you said, involvement, like not just telling someone what to do. And that's actually one of the reasons that I didn't feel like I fit with the marriage and family is, I really liked with coaching how it was kind of, nobody knows themselves better than themselves. And I'm not saying that that person knows all of the answers immediately, but they have them in them. And what I really valued about coaching was that I'm not just dictating to this person they're going to follow the steps. They have an active role in their healing. And it's as a coach, it can be very difficult sometimes. I will see a pattern, I will see something, and I want them to kind of figure it out. Because that's when it sinks in more, right? That's when you're like, oh my gosh, versus me just saying, hey, here's this pattern, you need to fix it.
Right.
I will kind of start to pull it out. It depends on the situation. Sometimes I do just tell them, but because I want them to be involved. I want their neurological pathways to be doing some work so they are more equipped for future issues, and future obstacles and future problems. And so, in that regard, it's about the individual. It's about, we're not just numbers. And I think that's probably one of the biggest things from a medical and also an emotional standpoint is we are all different, and having someone to work with you to help you understand your individual physical, emotional traits, whatever, and also your capabilities is way more empowering than these are your numbers and this is what's wrong with you.
Yeah, you don't say.
You're like, cool,
Yeah, you look like everybody else, and your risk is the same as everybody else. Yeah.
And same with the emotional thing. It's like, okay, you have this diagnosis, and you're like, what am I supposed to do with that? So now I'm this, now what?
Right.
Do I use it as a crutch? Is this just, am I doomed forever? Is it, it's rather than, hey, this is what I see, but let's figure out how we can make it work for you in your life.
One thing I've been curious about as a person that has not had cancer is after somebody has cancer, there seems to be a label that is like, I'm a cancer survivor. I'm a cancer survivor. Do you find that can be empowering and disempowering for people?
Yeah, probably.
What I just always think about that as like, this is my new badge. Like, I'm a mother, I'm a runner, I'm a, maybe I'm a nurse, I'm a this, and I'm a cancer survivor. And it's like, I'm going to hold that right here for the rest of ever. Like, are we helping people? And maybe we are because you have a tribe or you have you've got a community now of other people. Right. But I'm always curious about that. What are your thoughts on that?
I think you're totally right. I think it just depends on the person, and it's probably a plus and a minus. I think any labels are, right?
Yeah.
I think that the good thing about it is a lot of, well, not a lot, but enough people talk about it as part of their processing. Like, if I have a problem, do not answer the call, because I process things through talking. So I will just talk to you and sometimes at you just because it helps me process, right? And I do think for some people, it makes the demon feel smaller. It's kind of like an ownership.
Yeah.
And then I do think the positive side of it can be that there are so many younger people. It's so funny because I got diagnosed at 41, and that's kind of when you're for a lot of people, your first like age crisis,
Yeah.
I'm like, if you want to feel young as you hit middle age, get diagnosed with cancer, because everyone's like, but you're so young, and you're like, I know, I'm just a baby. But there's so many younger people that have had cancer. So when people like me say it, it's like, oh my gosh, I'm not alone. I'm not, because one of the things I think is so hard about getting cancer at a younger age is that you are instantly, no matter how great your support system is, I mean, it's amazing to have a good support system, but you're instantly ostracized from your peers. You're instantly, no one can understand what the flip you're going through. And you are the girl that had cancer, the woman that had cancer. I remember being at a dinner party with my closest friends, like maybe 3 years after I had cancer, and there were like 18 women there. And I remember looking around, and I was like, none of these women have had cancer. I am the only one. Like, that just blew my mind, because I know how common it is, and I talk to people, and I see people all the time. But you feel a bit like a freak. You feel a bit like the weirdo. And then again, you go to get support, and you go to these institutions that are lovely, but they're so dated. Yeah. And it is, and you walk in and you don't feel like you belong there either. And so it's very, very isolating. So when you do see someone like me or like whoever, and they're like, yeah, I'm a cancer survivor, you're like, oh my God, you too? And it kind of normalizes it in a weird way.
Yeah.
But again, labels, that's part of the reason that I left marriage and family. On the flip side, I think labels, people can use them as crutches a lot.
So it depends on the person.
It depends on the person.
Theme.
Yeah. Individuals.
Weird.
So how are people finding you to work with you?
Yes. I will say it's shockingly been a lot trickier than I thought it would be, because it is such a massive gap and such a massive void. But when you're that new, it's harder for people to see you. So mostly online is my very roundabout answer. Mostly on social media and then word of mouth. I do have, I've done a lot of volunteer work with local breast cancer organizations. And I've done even volunteer work with some, virtually, like on the East Coast a lot. There's an organization that's pretty large. That's mostly younger people on the East Coast. Not that I only work with younger people, but, who's drawn to me, probably the loudness. And I'm like, I don't know.
It's the big earrings.
I can't I know I'm making expressions. No one can see them on a podcast. Just the big. So yeah, that's pretty much how people mostly find me.
What's your website and your handle?
Website is www.choicecoaching.org. I had to think about that one. It's very simple. I've had it forever. I rarely give my website up, I guess, verbally. And then handle is Choice Coaching on Instagram and on TikTok. So apparently it's unusual enough that not everyone has that handle.
Which is...
I know.
You do.
I guess so.
It's yours.
Yeah. I guess so. So yeah, it's usually that. And I'm always like, especially on social media and stuff, I'm always like, just hit me up. Like, I don't want anyone to feel, it's very, very, very lonely going through cancer. It's extraordinarily isolating. So I'm always like, even if we don't work together, just to know that someone is like, hey, I see you, you're going to be okay.
Yeah.
You're going to be okay.
You want to ask the wrap up?
We have a wrap-up question.
Okay.
So we ask all of our guests, what does whole health mean to you?
Why do you guys keep asking me these hard questions today? Let's see. Whole health. Oh, Megan, I'm sorry. I think it's individual. It is though. I think whole health means something different to everybody. And I think to me, whole health is about my body, right? Like my personal body, not stats. And then growth, I think, is a big one for me. And openness is a big one for me in whole health. Like learning more, being open to learning new things is huge. And then, of course, mental health. Mental health is huge. If you don't have your mental health, if you're, we have that a lot, like as cancer survivors, like I'm not meaning to sound ungrateful. Like I'm happy to be alive, but I can't function emotionally. I don't know who I am anymore, and so that is definitely part of whole health. Even if we're, declared no evidence of disease does not mean that we are thriving.
Right. Thank you so much for being here. What you're doing is really important. I hope more people know about it because I think having the support that you offer will help people really truly move back into their state of total health.
Yeah.
Yeah.
And maybe even feel better. I get
Right.
that people they're like, oh my gosh, I felt better than I did before I got diagnosed. I'm like, great.
You're welcome.
Let's get you where you need to be,
Totally.
But thank you. I appreciate it. Thank you all for having me.
Really appreciate it.
Thanks for being on.
Thanks so much for tuning in to the Whole Health Podcast.
If you enjoyed what you heard today, please follow us on social media and wherever you listen to podcasts.
You can find out more about us at thewholehealthpodcast.com.
You can find me on my website, blodgettdentalcare.com.
And you can find me at bioloungepdx.com or learn more about my organic soluble fiber supplement, Fluorosophy, at thinkfluorosophy.com.
We look forward to seeing you next time.